Trends, Den Trends.
Hello everyone, and welcome back to another episode of the Den Trends Den Talk podcast. I'm delighted you're joining us once again as we continue exploring the science, innovation, and clinical principles that shape modern dentistry. In today's episode, we're taking a deeper look at dental implants, but from a different perspective. Instead of focusing on the surgical procedure itself, we'll explore the biological and mechanical foundations that make dental implants one of the most successful treatments in modern restorative dentistry. As clinicians, we often talk about implant placement, digital workflows, or prosthetic restorations. But behind every successful implant lies an incredible biological process and precise biomechanical engineering. Understanding these principles is what separates simply placing an implant from achieving predictable, long-term clinical success. So, let's begin. At its simplest, a dental implant is a biocompatible device that replaces the root of a missing tooth. Once placed into the jawbone, it serves as a stable foundation for a crown, bridge, or full-arch restoration. Unlike removable dentures or traditional bridges, implants don't simply rest on the gums or depend on adjacent teeth for support. Instead, they become integrated directly with the surrounding bone, allowing them to function remarkably like natural tooth roots. This unique relationship between the implant and bone is what has transformed restorative dentistry over the past few decades. But what actually happens after an implant is placed? The answer lies in biology. Immediately after implant placement, the body initiates a highly organized healing response. Blood vessels surrounding the surgical site begin delivering oxygen, nutrients, immune cells, and growth factors essential for tissue repair. Platelets become activated almost instantly. Beyond forming a blood clot, platelets release signaling molecules that trigger the healing cascade and recruit cells responsible for regeneration. Soon after, fibroblasts migrate into the surgical site. These specialized cells begin producing connective tissue that supports healing and helps stabilize the surrounding tissues. At the same time, bone-forming cells begin rebuilding the implant site. Gradually, the area transforms into an active zone of mineralization where new bone develops around the implant surface. This biological activity is the beginning of one of the most remarkable processes in dentistry, osseointegration. Osseointegration is the direct structural and functional connection between living bone and the surface of the dental implant. It's what allows implants to become permanently anchored within the jaw. Unlike natural teeth, implants do not have a periodontal ligament. Instead, they rely entirely on direct bone contact for their long-term stability. As healing progresses, bone continuously remodels itself. Old bone is gradually replaced by new, stronger bone that adapts to functional forces. This remodeling process doesn't stop after healing is complete. It continues throughout the life of the implant, helping maintain stability under everyday chewing forces. However, this process is delicate. Small amounts of controlled movement during healing may be tolerated, but excessive movement can interrupt bone formation. Instead of achieving osseointegration, the implant may become surrounded by fibrous connective tissue, leading to instability and eventual failure. That's why primary stability during implant placement is so important. Now let's talk about something equally fascinating, the way implants attach to bone. Implant stability depends on two complementary mechanisms. The first is chemical bonding. Modern implant surfaces are designed to encourage calcium and phosphate ions from surrounding bone to bond directly with the implant surface. This biochemical interaction strengthens the implant's connection with the jaw. The second mechanism is mechanical interlocking. As new bone grows into the microscopic surface irregularities of the implant, it creates a strong physical lock that enhances stability. Together, these chemical and mechanical interactions create the remarkable strength that allows implants to function almost like natural tooth roots. Of course, biology alone isn't enough. Patient health plays an equally important role. Successful implant therapy depends on several essential factors. Healthy blood circulation is critical because healing tissues require a constant supply of oxygen and nutrients. The implant site must remain free from infection. Healthy soft tissues surrounding the implant create an effective biological seal that protects the underlying bone. Adequate bone quality and quantity provide the mechanical support necessary for long-term success. When these conditions are maintained, implants can function successfully for decades. So why have implants become the preferred option for replacing missing teeth? The answer lies in both function and preservation. Unlike conventional bridges, implants do not require preparing healthy neighboring teeth. Unlike removable dentures, they remain firmly anchored during chewing and speaking. They distribute biting forces more naturally throughout the jawbone, helping preserve bone density and reducing the gradual bone loss that commonly follows tooth extraction. Patients often describe implant-supported restorations as feeling almost identical to natural teeth. They enjoy improved chewing efficiency, greater comfort, enhanced confidence, and significantly higher long-term satisfaction. This is why implants have become the gold standard in restorative dentistry worldwide. But as remarkable as implant technology has become, success is never guaranteed by the implant itself. Long-term outcomes depend on respecting biological principles, understanding biomechanics, maintaining healthy tissues, and following sound clinical protocols throughout every stage of treatment. Technology continues to advance rapidly. Surface modifications, regenerative biomaterials, digital planning, guided implant surgery, and artificial intelligence are all improving precision and predictability. Yet, despite these innovations, the fundamental principles remain unchanged. Healthy bone, healthy soft tissue, precise surgical technique, thoughtful prosthetic planning, and a clear understanding of biology. These are the true foundations of successful implant dentistry. As we conclude today's episode, remember that dental implants are far more than titanium fixtures placed into bone. They represent an extraordinary partnership between biology, engineering, and clinical expertise. When these disciplines work together, implants provide unmatched stability, function, aesthetics, and longevity for millions of patients around the world. Thank you for joining us for another episode of the Dentrends DenTalk podcast. At Dentrends, we're committed to bringing you evidence-based clinical knowledge, emerging technologies, expert insights, and the latest trends shaping the future of global dentistry. Visit dentrends.com to explore more podcasts, clinical articles, dental innovations, product reviews, conference coverage, and educational resources created for dentists, students, researchers, and industry professionals worldwide. Until next time, stay informed, stay inspired, stay ahead with Dentrends.